Our next major subsection is radiation oncology. Please turn to that now and follow along. The treatment of cancer with radiation can be used alone or in combination with surgery and/or chemotherapy. Radiation oncology is the multidisciplinary medical specialty involving physician, physicists, and dosmetrists, nurses, biomedical scientists, computer scientists, radiotherapy technologists, nutritionists, and social workers. The radiation oncology section is further divided into consultation, treatment planning, radiation physics, and dosimetry. Various treatment deliveries, hyperthermia, clinical intracavitary hyperthermia, and clinical brachytherapy. The most important guideline you can highlight or underline here is the last sentence of the first paragraph in the guidelines, which states they include normal follow-up care during course of treatment and for 3 months following its completion. The consultation for clinical management by radiation oncologists is reported by codes from the Evaluation and Management section in the CPT coding manual. Radiation oncology is complex to code. You won't be tested too much on it, but you need to know the basics. The selection of treatment planning is based on levels simple, intermediate, and complex. To select the appropriate level, you will need to understand a few additional definitions. Ports are the place on the body where the radiation is being aimed. The definitions of treatment planning have references to a single port, simple parallel opposed ports, converging ports, and tangential ports. Most patients have more than one treatment port. Blocks are pieces of lead designed to the patient to cover up normal tissue so that the radiation focuses on the tumor and not healthy normal tissue. The second set of codes in clinical treatment planning is for therapeutic radiology simulation. Simulation is where the radiation oncologist uses imaging to plan how to direct the radiation. Typically, the patient will lie very still on a table while the radiation oncologist determines the ports. Sometimes it is necessary to use a body mold to keep the patient from moving during treatment. Simulation codes are selected based on the definitions in the guidelines for simple, intermediate, complex, and three-dimensional. You should read those. The design and construction of the treatment devices, such as blocks and patient immobilization devices, are reported with codes from the next radiation oncology section of medical radiation physics, dosimetry, treatment devices, and special services. Also included in this section are services performed by the dosimetrist, who determines the proper radiation dose, called dosimetry, and the radiation physicist, who makes sure that the machine delivers the right amount of radiation to correct the site in the body. Your next several sections for stereotactic radiation treatment delivery, neutron beam treatment delivery, and intensity modulated radiation treatment delivery, IMRT, represent a technical component only and would only be reported by the hospital. You should write that down in case it's a trick question. CPT has included a parenthetical instruction to report 77387 with a 26 modifier for the professional component of IMRT. Refer to the Radiation Management and Treatment table in your CPT Professional Codebook for a complete listing of CPT codes. The next radiation oncology subsection to discuss is radiation treatment management. Radiation treatment management typically consists of review of port films, review of dosimetry, dose delivery, and treatment parameters, review of patient treatment setup and patient visits for response to treatment, coordination of care and treatment, and review of ancillary results. It is reported in units of 5 fractions or treatment sessions, regardless of the actual time in which the services are furnished. In other words, the patient can come in on Monday, Tuesday, Wednesday of one week, and Monday, Tuesday of the next week, and that would be reported as 5 treatment sessions. Sometimes you will have patients who might have treatments 2 times per day. This will be reported as 2 fractions per day. Radiation treatment management for 5 treatments is also reported if there are 3 or 4 fractions beyond a multiple of 5 at the end of the course of treatment. 1 or 2 fractions beyond a multiple of 5 at the end of a course of treatment are not reported separately. That's an important guideline you should write down. If there are 7 treatment sessions, you still only report 5. Hyperthermia is the use of heat. Hyperthermia in conjunction with radiation therapy is currently under investigation. Some insurance policies will allow the use of only deep hyperthermia with radiation therapy, but consider it investigational with superficial hyperthermia. Before reporting hypothermia codes, make sure to read through the guidelines in this section. Brachytherapy. The final radiation oncology subsection is clinical brachytherapy. Brachytherapy uses radioactive material sealed in needles, seeds, wires, and catheters. The sealed radioactive material is then placed in or near the tumor. You may also hear this referred to as internal or implant radiation therapy. You could write this at that section. Interstitial brachytherapy is when the seeds or other sealed radioactive material are inserted into tissue at or near the tumor site. Intercavitary brachytherapy is when it is inserted into the body with an applicator. Now let's talk about the nuclear medicine section. At our last major subsection of radiology and nuclear medicine, which is subdivided into diagnostic and therapeutic. Diagnostic radiotherapy is the use of small amounts of radioactive material to examine organ function and structure. Some common scans performed include thyroid uptake to evaluate thyroid function, renal imaging to evaluate kidney abnormalities, bone scans for diagnosing inflammatory process such as osteomyelitis or for localization of bone tumors, heart scans such as myocardial perfusion and cardiac blood pool imaging, and brain scans to investigate cerebrovascular problems. Therapeutic nuclear medicine when radioactive material is used to treat cancer and other medical conditions affecting the thyroid gland. Let's look at my book. As you can see, I put notes about the 26 and TC modifier on the table of contents. You will use the table of contents to code or the back of the book. To code x-rays or MRIs or CTs, you'll go to diagnostic radiology and then the body part that it's at. For ultrasound, you'll go to the diagnostic ultrasound section. As you can see on the next page, I further describe 26 and TC, as well as put the examples of radiological examination equals an x-ray, CT equals computed tomography, and MRI equals magnetic resonance imaging. Look at how in the diagnostic radiology section, I bracketed CT scans, MRI scans, and then x-rays to fastly find the code I'm looking for. Even with x-rays, I would put the body part and bracket it, because if you're looking for a knee x-ray, you don't want to have to read through all of those codes. Make sure to read the guidelines in the diagnostic ultrasound section, the abdomen and retroperitoneum section. On the ultrasound obstetric, I have gestation equals carrying baby in womb. Make sure to read the guidelines for obstetrical pelvis ultrasound. I bracketed fetus and maternal evaluations. Code 76801 is for ultrasound pregnant uterus real time with image documentation, fetal and maternal evaluation first trimester, and it gives you the trimester weeks. Transabdominal approach. So if it was transvaginal, this would not be your code. Each additional gestation would be coded with 76802. 76805 is ultrasound pregnant uterus real-time image documentation of fetal and maternal evaluation after the first trimester, and it gives you the weeks, and it is still transabdominal. Underneath 76817, ultrasound pregnant uterus real-time with image documentation transvaginal, there is a parenthetical note that says if transvaginal examination is done in addition to a transabdominal exam, use 76817 in addition to the appropriate transabdominal exam code. Sometimes when a pregnant woman goes to get an ultrasound, they will try to do an abdominal ultrasound, But if they can't get the images or see the images appropriately, they will have to convert it to a transvaginal ultrasound. Let's look at the diagnostic ultrasound of extremities. 76881 is ultrasound extremity non-vascular, real-time with imaging documentation, complete. 76882 is the same thing but limited per anatomic site. Let me give you some examples of these. 76881 is complete if they are looking at let's just say a shoulder, and they're looking at all the soft tissue structures in that shoulder, such as the rotator cuff, multiple different structures in that shoulder, the rotator cuff, the biceps tendon, the subcapularis, the labrum. A limited is if they're just looking to see one specific thing, like how much fluid is on the joint, or just looking at the rotator cuff. Normally, these will say whether it is complete or limited in the scenario or documentation from the provider. Radiological guidance. A lot of these codes are add-on codes for codes that are the procedure codes in the different chapters, such as musculoskeletal, cardiovascular, urology. For example, 77001 is fluoroscopic guidance, central venous access device placement, replacement, or removal. 77002 is fluoroscopic guidance for a needle placement. And then you have your CT guidance codes and your MRI guidance code. Then you have your mammography procedures. 77053 is a mammary ductogram or galactogram, single duct. 77054 is mammary ductogram or galactogram, multiple ducts. And 77058 is an MRI of the breast without and or with contrast materials, unilateral. So one breast. 77059 is for both breasts. 77067 is a screening mammography bilateral. This is typically performed when patients become of a certain age to get a mammogram. And then under bone and joint studies, you have manual application of stress performed by a physician or other qualified healthcare professional for joint x-ray radiography. This is when they're doing an x-ray and they're actually manually putting stress on the joint. You will code 77071 in addition to the x-ray code. Under nuclear medicine, I have a note from the endocrine system where it says thyroid imaging, do not use when checking for metastasis of cancer, because the code on the next page is used for metastasis of cancer, 78015. That's the end to the radiology section. Make sure to study and then take your exam.